Hey everyone, and welcome back to What After Dentistry. Now, today's video is a highly requested topic that you guys have been asking for: how to get into research after BDS, what to do to get into research after BDS, can I do PhD after BDS, what are the colleges that one should go for if they want to do PhD in dentistry, and so on and so forth. So, to answer all your questions, today we have with us Dr. Pragati Kaurani, a professor, a consultant prosthodontist, and dental researcher from the last 15 years. She's actively involved in various research activities and have received a research grant from Govt of India on her current research topic on nanoparticles in dental materials. One of her research in oral cancer and prosthetic rehabilitation won the Dr. G.C. Das Memorial Award at the 48th National Conference of Indian Prosthodontic Society in 2020. She is currently pursuing PhD in prosthodontics to grow her research skills and find an association between the number of teeth contacts and nutritional status in Indian population. She has also authored a book on research methodology in dentistry, which is available on Amazon, ShopClues, and Flipkart. And this was launched by the Honorable President of DCI. She's also a reviewer in two national dental journals and recently became an associate editor for Enviro Dental Journal. So let's hear what she has to say about this promising field of dental research after BDS and MDS. Hi, Dr. Pragati. Welcome you once again on our channel, What After Dentistry, to talk about the research or how to become a dental researcher after BDS or MDS. Welcome you once again.
Thank you.
So, we would like to know, like, how should a BDS graduate get into research? Because this is something that this area is not covered while we are, in the education years of pursuing BDS. So, how to start with this particular career field?
Yes, you are right. Actually, at undergraduate level, we are not promoting too much of research. However, there are certain grants that ICMR provides, which are exclusively for undergraduates. So it's not that there is no research as such, but as it is, the BDS curriculum is very heavy in its academic form, and research becomes an added format. So it's not really pursued too much at undergrad level, but if somebody really wants to do, the best thing would be to catch hold of the internship time period, because before that you are really, really occupied with whatever your exam appearing subjects are. But when you are in internship, you can help or you can get attached to any departmental research that is happening, or even the postgraduates who are doing research. And there are what is called as the short-term researches, which you can do, which are also in fact funded by ICMR. So if you speak to people in your department, in your college, I'm sure your professors and teachers would be knowing this. If not, all that is available on the website of ICMR. You can go there and see. But having said that, you at undergraduate level, yes, the research is neither taught nor really encouraged, simply because the curriculum itself is so heavy. So, we don't have that much kind of a time to teach the undergrads. But slowly and steadily, I'm sure research is going to start penetrating even at undergraduate level. So it's getting there. And the sooner, the better. The students realize it increases their CV and chances further ahead, even if they want to apply abroad. So in that aspects, yes, it works.
Absolutely correct. So, as Dr. Pragati correctly said, if you guys are interested into pursuing research after your BDS, then make sure that you talk to your interns, talk to your faculty, and you can also check out the ICMR website, as she correctly said. So now, Dr. Pragati, we would like to know if we have a lot of questions from our fresher or people who are students who are pursuing BDS. They want to know, can they pursue PhD after BDS, or generally we know PhD is done after masters. But in
Yes.
dentistry, can we do it after BDS?
No. It cannot be done. For PhD, the mandatory requirement is to have a postgraduate degree, and you cannot pursue PhD unless you have a master's degree. that is a mandatory requirement all across this country.
Yes. And is it like masters, like only MDS, or any masters one can do and then go for PhD if they want to specifically get into dentistry?
Yeah, so if you specifically want to do in dentistry, you need to have an MDS degree. Though generally the degree of PhD comes as PhD in dentistry. So it's not really, does not restrict you to a particular subject like prosthodontics or general surgery or oral surgery. You just get a degree called as PhD in dentistry. So you can select any topic once you pass the entrance exams, and then, that's how you pursue it. Uh, that is how this happens in after the master's degree when you want to go ahead with PhD.
Okay. And can you suggest to some good colleges if somebody wants to apply for PhD?
So, for PhD, it is essential to understand the university rather than the college, because PhD essentially is a program run by the university. It doesn't come, the dental college facilitates the program. So when you are looking at any PhD program, try to see whether the university has got that PhD program certified by UGC. So once you have a UGC certification, we do feel that yes, the PhD is genuine and the program running in that university is also genuine. Actually, the Dental Council of India has not yet recognized PhD as a mandatory requirement anywhere. So there is no additional body which is monitoring the running of a PhD. The only other body which is seeing whether PhD programs are running correctly is the UGC. So it is essential to understand if that university has a UGC acclaimed PhD program. Once you know that, yes, that is happening and the program is running successfully over the years with full-time professors and guides and as well as the students, then you are assured that, yes, the PhD degree works in its genuinity, and it's not just for the name's sake. Like I said, there are no other regulatory bodies, so there's no way of knowing whether the PhD is genuinely running well or it's just a namesake. Then once you are clear about this, then there are various universities across India that are providing PhD. We have government universities also now, either, for example, in Gujarat, you even have the Maharashtra University of Health Sciences, which is providing PhD. So you have Baba Farid University that is providing PhD, and various private universities are providing PhD in dentistry. You have in Bharati Vidyapeeth, you have here in Mahatma Gandhi Dental College, Mahatma Gandhi University of Medical Sciences and Technology, which is providing PhD programs. So once you are aware and know that this is how it is, then you proceed. Why I'm saying about university is because, like, for example, the MUHS, it is Maharashtra University of Health Sciences, has so many colleges under it. So you can't apply under one college for PhD. You have to apply to the university. And once you get eligible through that university's entrance exam, according to your merit, you get a particular college. So that's how it works for PhD programs, just like it would do for MDS, etc. So it's best to see if the university is running this under UGC certified program. That's how it works.
Okay. So make sure that you take all these pointers down, and it is a mandate that you have to pursue masters, and specifically if you want to get into dentistry, I mean dental research, then it is always better to go for MDS and then go for your PhD. For applying for your PhD, it is always good to see whether the university is UGC certified or not. If it is running a UGC certified PhD program, if yes, then apply to the university, sit for the exam or whatever is the eligibility requirements for that university, and then once you get through, it is as per your merit, you will be given the college. So what kind of skills are required, especially for a BDS graduate, if they want to get into dental research? What are the skills that are required to do or to be a part of a successful research project?
So the research works slightly different from let's say clinical practice. When you have clinical practice, whatever patient comes in front of us, we need to treat that patient. But when it comes to research, your inclination towards any particular topic or subject is the one that speaks the most, and you will put in most of your effort only when it is a topic of your interest. So the first thing that even I tell even the postgraduates who are selecting their topic, even if it is just prosthodontics, what in prosthodontics appeals to you the most? Is it removable partial dentures? Is it complete dentures? Is it implantology? In implantology, are we talking about single implants? I mean, if you have some idea about it. So while you were studying or you were doing your graduation, I'm sure you know, the students, there are some topics or something which catches their interest. You know, they feel, yes, this is what I really like to do. Perhaps it could be microbiology, it could be just old age, treating old patients. Any one thing that appeals and clicks to you. That is the first and foremost thing, because research requires, let's say, an admin 2 to 3 years dedicated on one topic. So at least that topic should be something very close to your heart. So the first thing is to find out where your interest lies. The second thing is then to read more about it and find something which does not have an answer to it. That is what becomes a research gap, and you start researching. So while you are even in your dental college or in your internship, maybe assisting somebody, there will come some point where, you know, there are no answers to that question. So you start asking your seniors, how does this happen? Either there will be an answer or there will not be an answer. You then start searching the literature and see in journals and in textbooks, is there an answer to that question? And if there is no answer to that question, now that is your starting point where you start researching and finding answer to unknown questions. So that is how the process of research starts. The first thing is to find your area of interest. The second thing is to find what we call as a research gap, something that is not known, something that does not exist. And that becomes your stepping stone, and you start searching and finding a research project from there on. So whenever you are, you know, in your undergraduates, when you are doing your internship program, or in your undergrads, when you're doing your postings, prosthodontic posting, conservative postings, you keep your eyes and ears and everything open. And if there is some experience that you have come across, which doesn't have an answer to, which probably clicks to you, your interests also, that starts becoming your point of further move. So to answer the question, what is it that is required? Well, first thing is an inquisitive mind, a curious mind, and a researcher will always have a curious mind to find out answers which are not answered before, and to keep reading so that yes, this is already known and this is not known. And that is the point where we start working on in research, the point what is not known. So these are the things that the people who want to pursue research can look into and take it on from this point.
I think that's very correctly said. And yes, for research, it's absolutely correct that you need that one area of specific interest. If you want to explore that field, and you are more inquisitive about that particular field or question. So next we would like to know, are there jobs available in this particular field, especially for BDS graduates?
So, some of these very recently, the government has opened up a lot towards research. And very recently, you do have the junior research fellowship programs. And now and then they start coming out with ad hoc based posts which are applicable for MBBS and now BDS also. So there you have to be vigilant to these posts that keep coming out, and they keep coming out regularly, though they are on ad hoc basis, but they can carry on for 1.5 to 2 years. And from there on, once that research, that thing comes in your CV, you then further apply. In fact, even for senior levels, very recently now ICMR came out with the posting for the senior research fellows, where they were taking MDS people with some research background. So I do believe that it may take time, but over the years, perhaps this, the research concept, especially post-COVID, is going to open more and more avenues towards people in research. Other than that, specifically for research, certain areas in government, like for example, Maulana Azad takes research associates. And if nothing else, then any other college, private college, does take in senior lecturers who can also anyhow pursue research. And eventually you start guiding postgraduate students and, anyway, take up research. So that's how this process is at the given moment it is standing. Other than that, if you pursue research in terms of material sciences, then you can, venture towards the commercial part of dental materials. So there are companies then who will hire you because of your background in dental materials or whatever excellent work you might have done in terms of research work in material sciences. So there the competition, of course, is much tougher because you might have people from engineering background or the chemical background, but you also have a dental background. So it can add to your CV, and then it opens newer avenues in dental material companies who can take you up as a research associates. So that is at present what the research avenues have opened up.
Okay. So it's majorly on the ICMR website is what I can get from this conversation, that one has to go on the ICMR's website and then look out for these kind of research fellowships, especially for BDS it will be senior
Research. Yeah.
And then for MDS it will be senior research fellowships.
Yes, many of these websites, but you have to be vigilantly looking out for them. But even the Department of Science and Technology sometimes has a research project which is specific towards healthcare or things like that, where they recruit people who could be either MBBS/BDS. Then sometimes the Department of Biotechnology, again, central government department, is the one who takes it. Other than that, the state governments themselves have these same departments running. So they also have ad hoc based research programs where they recruit in the BDS people. So that is where the people have to be vigilant when the state governments also come out with their ad hoc postings of research associates and research fellows that they require. So that is how this whole thing works.
Right, absolutely correct. If you want to specifically get into dental research, it is always better to look out for these research positions at various government levels. You have to do it like on daily basis, or you have to be very, very vigilant with these websites and keep on looking at it. Also make sure that you have good contacts with your interns, with students who are pursuing MDS if it's there in your college, and of course with your faculty. So now, Dr. Pragati, we would like to know, if somebody is like after BDS, they have their own dental practice. So can they also work in a research project while they are into practice?
Generally not, because for any research work, first and foremost, you need to have clearances. There are certain clearances with certified or let's say registered committees which give you a go, and only then you can proceed with the research, what we call as the institutional review boards, and we call it as ethical committee. You cannot proceed with any research work unless you have a clearance by these committees. Now, these committees are essentially in colleges, though there are private entities who also have these committees, but they are again pharma based. So unless your research project is through that pharma company, those committees will also not give a green signal to your research work. So generally speaking, unless you are attached to a dental college, it may be difficult. But there are certain researches like I take up, which are what we call as multi-centric, in the sense we collect data from a lot of centers. In that, one of the centers could be one of the dental clinics or few dental clinics in a given area. Now, it is only then that data from that particular dental clinic can get included in a given research work, and that particular researcher can be associated with my research and proceed. Moreover, none of the dental grants come to an individual. They always come to an institute, naturally, because if they are going to give you money, they are going to make sure that it reaches a place which is not random. It is a place which is recognized. And that also not any institute can get a grant. There are a lot of requirements for an institute to fulfill. Only then they get the grants. So, just an individual sitting in a given clinic doing a research work, it doesn't generally work. You need to have clearances because you will ultimately publish. If you will publish, the publisher will ask you, have you got clearances? Yeah. So you cannot get clearance if you're not in a college. But you could be associated with some researcher. That could happen. For example, you team up with me, like I do a lot of research work. So if you're really keen, there are people like me everywhere who are attached in colleges, who are looking out for, projects and things like that. So if you are keen on doing some research work and not attached to a dental college, you can just approach a researcher who is in a dental college or any institute which can give you that clearances which you require, tie them up, make a project, and then start with the process of research work. That can be done.
Okay. Okay. So I think that's fair enough. And can you please list out the pros and cons of if somebody gets into this field? What are the advantages, the disadvantages with the field?
Well, the advantages come like the academic recognition that you get. In India, though, this is in some of the colleges, it is there where you get promotions and increments based on your CV. Some of the colleges still don't follow that. Whereas in countries outside the country, this is definitely followed. If you do a PhD, you become eligible to apply for faculties even in the Middle East. It becomes a mandatory requirement. So just as an MDS, you cannot attach yourself to colleges in the Middle East. Whereas here, if you do your PhD, you have a base to move out. If you're abroad, of course, PhD and research work is definitely adding on to increments and things like that. In India, so the pros become that yes, it gives you that academic recognition to stand out and stand away and apart from the rest of the academicians if you are pursuing the research work more aggressively compared to the others. The cons is, of course, that we've still not opened. India is still not a very open area for research. It's a new area, though I must say that it is opening up slowly and steadily. All universities are going through NAC, which is supposed to be a mandatory requirement by the Dental Council of India also. And NAC has a very strong research component as a requirement from a university. So I feel that over the years, this is going to come and increase over a period of time. That people will start looking into research more seriously and give you increments and give you a lot of other things. Moreover, now you have a lot of competitions, awards, nationally as well as internationally. Societies are giving their national awards to researchers, to students. The government has various schemes, and I must emphasize on this, various schemes for women scientists, which keep coming up regularly. You just have to see if that particular scheme fits into your requirement or not. They keep coming out for various other aspects, not necessarily dental, but somewhere down the lane there will come a topic which can be grabbed on by a dentist also. So I feel that it will take time, but yes, the country is opening up to research slowly and steadily. With the present government and the way things are moving ahead, I do feel the future is very bright. So if you are deciding to plunge into it, it may not be very glamorous to begin with, like a clinical practice, and it takes its time to ripen up. But I'm sure you'll get there. I am also trying to get there, and I'm sure these opportunities will open much more for the younger generation in the times to come.
Yes, absolutely correct. And I think even if you start with a dental practice, it takes a good amount of like 2 years, 3 years to at least, give you that, reach out that break even point and then give you the amount that you were desiring for. So I think I feel the same way would be for the research also. Any research project you take, it takes almost like 2 years, 3 years. And it's just
Yes.
that one opportunity. So if you get through that one opportunity, it's then you have the ample opportunities coming up. So all you BDS graduates, for MDS, we all know, research work, they've been doing it. So it's quite easy. They know how to do
Yes.
researches. But specifically for BDS graduates, if you're listening to the session, make sure that you have good contacts with your, seniors, with your interns, with your faculty. You look out with these websites, as Dr. Pragati has correctly mentioned. Look out for any kind of research associate role if you can find in dental materials company or in any project if you get through with your faculty. So this will definitely help you to grab that opportunity into research. And if you're really serious to get into this field, then it is a mandate to do MDS and then you apply for PhD. So lastly, we would like to know that what are the new technologies or advancements happening in the research? Like what are the new advancements happening in the dental research area?
Yes, so I had spoken about this in my national conference in regards to prosthodontics. So, yes, like you have advances, see, it's very simple. As materials are processing, you are having digital prosthodontics, everything is going digital. Obviously, research will also move in that direction. It's an obvious fact. So, where initially all the research was based on, let's say, impression materials, today all the research is based upon using an intraoral scanners. So this progress towards the topic in research is obvious. As the topics are processing, the research will also progress in that direction. But other than this, also there is a lot of progress in the sense there is a lot of softwares which are available now open for researchers to use. Initially, everything was manually being done, but now with these softwares, it is in fact better. Let's say, put it this way: if you use those softwares, if you don't use those softwares, it seems as if you are still living in a old age form. So doing one thing is the topic that you select, which becomes the newer topic. If I just select something which is very, very in. The second thing is I do also use all those tools which are available to do that research.
Yes.
So both the things need to be now updated. For example, I will give you a very simple example. You have, let's say, a reference manager softwares. So from all these years, I have been doing referencing manually because that's how we did it in MDS. That's how we did it even later. But now there is a software available. And if I don't use that software, I become obsolete. So that is the new advances in research. And research helps you to connect with researchers across globe. You can form a team. Like I can be an Indian, I could have someone from America, I could have someone from UK. Now if I have a team of researchers from different countries, I can't be doing something which was done 20 years back. So I need to be updated with things that are happening. So currently in research, this is a very good question. And like I said, my topic of a national speaker was the same, that what are the recent advances? So the advances move not just in the topic, but how you do research also. You use the tools and softwares which are available. Today, for doing systematic reviews, there are so many softwares that are available. So a researcher needs to know that these are the things available and I must use it. I must not sit with the same paper and pencil and do it the way it was done many, many years back. And this is also changing very fast. It's progressing as we talk. So if we have these tools which we use in research, and just we've been using that tool since many, many years, and just a few months back it got updated to the newer version. So if today also I am using the same old version, then either my article will not get published, or it will be outdated or whatever. So you need to be updated in research, just like the way you need to be updated in, let's say, clinical practice or anything else, because things are moving at a very, very rapid pace, even in research. So that's another thing which we all need to be all the time reading and all the time updating ourselves.
I think that's very, very important. So, last tip or advice for a dental graduate who wants to get into research?
For dental graduates who want to get into research, please firstly expose yourself to research while you are in a dental college. That is the best place to do it. Coming out, you might struggle. You might begin with a point which may not give you that kind of an exposure or an area. When you are already in a dental college, there is research happening, definitely. All you need to do is to jump onto that train. So while you are there, make use of that time. Do a short project, just get into it. Unless you plunge into it, you will not know what it is. So the first thing is, while you are there, just attach yourself with these department projects which are happening, or walk up to your teachers and say, we want to do something, please guide us and help us, because you can't do it on your own. You need to get that guidance. That's the first thing. Second thing is, go ahead and do these short courses, because there are no university certified courses as of now. So unless you are actually doing MDS or PhD, there are no courses which are helping you to do research. So do some certified courses which help you to understand what research is, because it is completely different from whatever you have studied in in your BDS curriculum. The BDS curriculum forms a base, but research is totally different.
Yes.
So get that out of your way, get it clear in your head that this is how you need to do. Keep reading, keep attending conferences to know what the world is doing. Because in research, the platform is not my country, my city, or my area, like in clinical practice. In clinical practice, my person who's across the road or who has a clinic is my real competitor. But in research, the competitors are across the globe. So in India, if the project is happening, I'm competing with the UK project, I'm competing with the US project. That is how it happens. So unless you are well read, and have that whole curiosity to go ahead, it will not work because the competition is very high, and we need to be updated with what's happening. And if you have the interest, let's say in public health, that is the area which will open lot of newer ventures, because there is a lot of different kind of research and projects that happen there. So if you develop this, though it's not spoken too much in India, but public health is one place which incorporates a lot of funding from various foreign organizations also. So if you had that exposure in undergrad, very good. If not, then try to get that exposure of public health dentistry that will lead you to bigger research projects which you can venture into. So these are a few things that undergraduates can take up and slowly and steadily build upon their profile, so that research can become an added thing in their caps.
Absolutely. So I think these are well said points, and all the points, all you audience who are listening to this session, then make sure that you have these points written down and you work on these points if you are really keen to work on research or work as a dental researcher going forward in your career. So thank you so much, Dr. Pragati. I think you've collated the entire information and given such beautiful and such informative pointers that I think it's very, very difficult, as you said, that this field is still it's at a infancy stage. What I can guess from this particular conversation that we had. So it is very important that people get to know that there is this avenue which is coming up, and if you're really serious or keen to work on this area, there is a process involved, and start working on that process right from the beginning. So thank you very, very much for giving us this information. I think this is a very, very motivational session for all the BDS graduates, because I see a lot of BDS graduates asking for or how to work in
Yes.
research, how to do PhD, and all these kind of questions. So thank you once again
Yes.
for coming on our platform and sharing all the insights.
Thank you, Dr. Shirin. Thank you for having me. I hope I have clarified. Yes, research is the road less traveled, but it's also has its challenges ahead. So I wish your audience all the very best, and I would really like to hear from people, because we need to connect to people who have that kind of an interest into it. So if there are people there, please reach out to me, and then from there onwards, if I can guide anyone personally also, I'll be more than happy to do that.
Yeah,
Thank you so much.
absolutely. So I will be sharing the LinkedIn link of Dr. Pragati. You can connect with her if you want to get into research, and if you want to work on any research project. She is the best guide who can help you in this particular career field. So for all the audience, if you're listening to our session today, thank you very much for patiently listening to us today. And I hope that you get motivated with this session. I hope that most of your questions were answered, and you work in the research project as you desire to. So thank you, everyone. Before I sign off, please subscribe to our channel, like and share this in your network, because this might help out people who really want to work into dental research. So thank you once again. I will see you in the next video. Until then, bye and good luck.